Good morning, everyone. Thank you for joining us, or good afternoon, depends where you're joining us from. So I have the pleasure today to welcome Dr. Zach Schlader, who is an associate professor from the Department of Kinesiology in Indiana University School of Public Health at Bloomington. Zach is an expert in human thermoregulation and heat stress, and he's serving as a co-director of the Thermal Extremes Laboratory at Indiana University. His research is bridging the lab experiments into fields to improve health, safety, performance in extreme environments. So welcome to the Water Talk. Before we start, I wanted to thank Unilever Wellbeing Commons for financially supporting all these Water Talks. Thank you, Zach, and welcome to Arizona.
Thank you very much for that introduction, Stavros, and thank you for the invitation to present with you all today. So we're going to talk a little bit about some of our work related to the work in the field relative to, and some of the stuff we've done in the lab, and then and kind of how we're working to translate back and forth. And before we get going, I want to just acknowledge I am a senior research advisor with La Isla Network, and a lot of this field work, they've kind of opened the door to allow us to do a lot of this field work, which has been a really cool collaboration. And then also I want to acknowledge that on the very beginning, the people in this box were really the students and postdocs that really drive a lot of this work, all the way from my first PhD student, Chris Chapman, all the way to Emma Reed, who's a postdoc that just started, I think, on May 1st. So there's been a lot of people involved in this work. So I have no conflicts of interest to report. These are the learning objectives that hopefully by the end of this today, you will be able to take away some of these things. And then finally, this is the outline that we're going to talk about today. So first, the big picture: what's the challenge of work in the heat? Defining the problem of heat in the workplace. Just because it's hot outside doesn't mean that workers are at risk. It's a function of how hot the workers are actually getting. And then just provide a little bit of information related to how do we minimize the risk of heat in the workplace. And throughout this, we'll talk a little bit about hydration and what the modifying roles. And then we'll summarize it. I'd be happy to answer any questions that anyone may have. So we'll start with the big picture. So I can throw up a number of different headlines. These are just a few. If you Google, hey, what's the effect of extreme heat? What are some headlines on workers? You get things that look like this. There are hundreds of thousands of these throughout the world. They're going to start picking up here. I think the one in the top left is actually from March. So think of, it was in the 80s in the Northeast in March. And this has pretty profound impacts on the workforce. So this is not only something that we see in the academic literature, but this is very much something that's in the everyday media. Why is this important? These numbers are from International Labor Organization report from 2024 that did a huge analysis to try to understand what are the broader impacts of extreme heat in the workplace. And what this analysis demonstrated is that 70% of the working population are exposed to excessive heat or extreme heat in their job. And that's about 2.4 billion with a B workers. That's a huge amount of workers. In the United States, an OSHA analysis estimates that about 36 million American workers or workers in the United States are exposed to extreme heat. So this is not a trivial portion of the working population. There are some numbers related to this. You've probably seen somewhat similar numbers. Almost 23 million non-fatal injuries are associated with extreme heat, and it's about 19,000 deaths annually, which the good thing is that, for something that has 23 million non-fatal injuries, that it's only translating to a risk of about 19,000 deaths is probably a good thing. However, it does underscore that extreme heat is impacting a lot of people and has deleterious health and safety impacts. The one thing I also wanted to point out is that this is not just a health and safety impact. Heat has a profound impact on productivity, such that recent estimates indicate that occupational heat stress accounts for about 10% of productivity losses, and are expected to increase by up to 40% by the end of the century. And I should note that productivity here is defined as changes in worker physical or mental capacity and the economic costs associated with that. There's been a number of studies to try to help define or quantify the magnitude of the impact of heat stress on productivity. And one I'd like to particularly highlight is from Josh Foster when he worked with George Havenith at Loughborough, where they developed a lab model for trying to understand how physical work capacity may change as a function of heat stress. So this is depicted here on this figure. Where on the x-axis, we have heat index, which is a function of ambient temperature as well as humidity. On the y-axis, we have physical work capacity. And hopefully what you can appreciate is that from relatively cool conditions all the way to extreme, we see a profound reduction in physical work capacity throughout that time. And I bring this up because I'd like to highlight that these conditions and the impact of extreme heat or heat in general is affecting our workers today. So here, this is just these data redrawn in a different way. We have air temperature on the x-axis and relative humidity on the y. And we have how the physical work capacity is changing. So from green all the way at 100%, all the way down to kind of a maroon, which, you know, we have very, very profound reductions in physical work capacity. And so if we use this, we can highlight that in the United States today, worker physical capacity is reduced by up to 30 to 40%. So just some examples of this, we're doing some work in Louisiana. So in the Southeast United States, a 90th percentile summer day during a normal from 2018, 2020 type of time frame, you're seeing about a 30 to 40% reduction in physical work capacity. Similarly, South Texas, so think Houston area, we see a similar finding, about 40% reductions in physical work capacity. And then, for example, Southwest, so Phoenix area, you can see similar reductions in physical work capacity. So hopefully you can appreciate that heat stress, occupational heat stress is really impacting health and safety as well as productivity. And finally, to cap off this section, I think it's really important to note that these effects are not being seen primarily during heat waves. This is standard heat that is seen typically throughout the year, particularly in the summertime. So these are data from that ILO report that I mentioned earlier, where they demonstrated that about 90% of worker exposures during extreme heat are occurring outside of a heat wave, and that about 80% of the injuries linked to extreme heat are occurring outside of a heat wave. Okay, so hopefully I've sold you on the big picture and what the kind of occupational and public health challenge of extreme heat is. Next, I'd like to talk a little bit about defining this problem of what extreme heat really is and what it's doing. So to do this, we need to start with what's the definition of occupational heat stress. So occupational heat stress is really a function of two things: the environment, so things like ambient or dry bulb temperature, humidity, so wet bulb temperature or relative humidity, however you want to describe it, as well as radiant heat. There's a number of different metrics that you can describe this. So heat index, wet bulb globe temperature, etc. As well as metabolism. So this is the amount of heat that your body is producing due to kind of basic cellular energy production. And so this is largely a function of the absolute VO2 or oxygen consumption or absolute exercise intensity. Also modifying these things are clothing. So if workers are wearing a lot of PPE, this will also impact their magnitude of occupational heat stress. So these factors come together to elicit a physiological response, which hopefully will help prevent excessive rises in body temperature. But what we see are increases in core body temperature or hyperthermia, and this triggers increases in sweat loss to help us to lose heat. Now, if we have insufficient fluid intake, that can lead to dehydration, as a lot of you know. And then there's a feedback loop here where people get dehydrated and they have a higher likelihood of developing hyperthermia. So the important factor here is that it's not all about the environment. And the part I want you to take away from this is not just the environment, it's actually the environment, how hard workers are getting, and what their clothing is that really drives this physiological response that underlies these changes in productivity, that underlie these changes in health and safety outcomes. So our work in this area, we've really focused on the construction industry here in the United States. And so here I'm going to introduce this idea of why we're focusing on construction. The first is that construction comprises about 6% of all the workforce, but they account for about 36% of all work heat-related deaths. Okay, so construction workers appear to be at a disproportionately high risk of bad things happening due to heat. Also, an analysis from quite some time ago has demonstrated that the number of heat-related deaths in the construction industry is rising, and this rise appears to be paralleled by an increase in summer temperatures. A while back, about 5 years ago now, we were very interested in trying to understand what are the exposures that the American workforce is experiencing. So we scoured the literature in a semi-systematic way to try to understand, what are the magnitudes of heat stress, particularly environmental heat stress, are being seen in the U.S. workforce. And what was really surprising to us is that we found no studies documenting the magnitude of heat stress in construction. And this was really surprising because I think we've all seen a roofer on a hot day where you're like, man, it's got to be really hot up there, right? Or, you've seen guys working on the road construction and it's super hot. You can see the heat coming off the roadway, right? And so we were shocked to see that we really have no idea how hot workers are getting on any given day. And so this is, over the last 3 to 4 years, really put us down this pathway of trying to understand how hot these workers are getting and what are the health and safety ramifications of that. So we've spent the last 3 summers going out to job sites and instrumenting workers. This is work that is done largely in collaboration with La Isla Network, which I mentioned at the start, as well as these are Turner construction sites. So Turner Construction has been a really good partner for us on this. These are commercial construction sites. So think they're not building houses, they're building data centers and battery plants and all these things. These are huge operations, stadiums, stuff of that nature. So this is just an example of some of the things that we were doing. And we really wanted to try to understand what were the factors driving how hot workers were getting. So based on our previous slides, we know it's largely a function of how hard the workers are working and what their exposures are from a thermal perspective on the job site, keeping in mind that their clothing is about the same in all of these instances. So what I'm going to show you are just some scatter plots relating how hot the workers were getting. So peak core temperature, in this case, it's an estimated core temperature from wearable devices, and over how hot the job site was. This is peak wet bulk load temperature. You can see we have a moderate correlation between these two factors. And then we also have on the right side here our marker or a measure of how hard the workers are working. So what we were doing is this is how much of their workday they are engaging in heavy to very heavy work. So this is our intense work duration. And you can see a little bit stronger correlation between how hard the workers were working and how hot they got relative to how hot the environment was. And I should mention the wet bulk globe temperature was measured at 8 sites throughout the job site, and we matched that to about where they were throughout these job sites. We want to take this a step further. And so want to try to understand what were the risk factors for when a worker had a core temperature of above 38 degrees Celsius versus below. And so we worked with a big biostatistics team, and we did some logistic regression with this. And these are the factors that came up in our analysis as statistically significant. So we had changes in urine-specific gravity across the work shift. So a metric of how dehydrated they're getting. It's not perfect, but in a field sense, it works. We do have gender or self-reported biological sex. Keeping in mind, we're not going to talk a lot about that today because we only have 7 or 8 women in this cohort of about 180 people. That largely reflects the construction workforce, unfortunately. So we're not quite sure how to interpret that. And then the other two were the intense work duration, as well as the peak level of globe temperature, were all statistically significant. This is what the odds ratios look like. And we'll talk a little bit about the huge error bars up for the USG. But for those of you that are less familiar with, I'm not statistically inclined, so I'll help describe what these odds ratios mean. So we have an odds ratio of 1.2 for peak wet bulb globe temperature. So that means for every 1 degree C increase in wet bulb globe temperature, the odds of having a core temperature of greater than 38 degrees increase by about 20%, right? Secondarily, or similarly here, we have an odds ratio of 1.1 for intense work duration. So for every 1% increase in the proportion of the day in which workers are working intensely, their odds of being hyperthermic increase by about 10%. And then finally, we have a little bit higher odds ratio for the role of dehydration here, or the change in USG. So for every 0.001 units increase in USG, you have an increased odds of being hyperthermic by about 80%. Now the USG is a little bit tough. The units are very, very small, as you know, and they're kind of categorical. So we're still trying to work through how to interpret this, but physiologically, I think it makes sense. As we know, as people become dehydrated, they have a higher likelihood of becoming hyperthermic. Okay, so I'd like to a little bit transition here to, we've started to figure out how these workers are getting hot. But what does that mean from a health and safety perspective? And one thing that I'd like to, hopefully, if everyone walks away today with one thing, it's that the risk is due to how hot the workers are getting, their body temperature is getting, and not what they're exposed to. And so here's just a different way to depict that occupational heat stress kind of paradigm that I demonstrated, that heat stress is a function of the ambient environment as well as metabolic heat production. And these two things together are responsible for or increase the risk of developing hyperthermia. Now, I'd be remiss not to mention that there are a number of things that could modify this. So things like older age, underlying health status, medication use, hydration, as we've talked about a little bit, climatization status, clothing, etc. But our working hypothesis is that it's how hot people are getting that is driving this increased risk of heat illness. Now, I realize this is not a particularly risky hypothesis, but if you look at the epidemiological literature, oftentimes when we talk about the impact of heat, they're talking about measuring heat index or wet bulb globe temperature on a health outcome. And sometimes they don't see something, or sometimes they do see something, but they're not accounting for the fact that of metabolic heat. And so we really need to know the exposure from a heat perspective is really how hot the person is getting, or how the magnitude of hyperthermia. And so when we think about heat illness, classic examples, heat exhaustion, heat stroke, which is the only potentially fatal heat illness. And then a more recent category that's really been pushed by or really been introduced by our colleagues in the US military, of heat injury, where we see things like cardiac strain as well as kidney strain. A lot of our work relates to this risk of developing acute kidney injury. So we're going to use acute kidney injury as a way for me to hopefully convince you that how hot the person is getting is hopefully the most important factor. So why are we interested in acute kidney injury? It really comes down to statistics such as this. So this is again from the ILO report. About almost 20, just over 26 million people are living with chronic kidney disease that's attributed to heat stress. You may have seen pictures such as this that was highlighted in the Journal of Science back about 10 years ago now. And really they've identified this epidemic of chronic kidney disease that's unrelated to traditional risk factors. So it's not related to older age, hypertension, diabetes, obesity, stuff of that nature. And so the top thing that seems to be the most prevalent in these things is that these people are working multiple days in very hot, humid environments. They're working very hard. And this seems to be a very consistent theme across numerous hotspots throughout the globe that seem to have a very similar characteristics of chronic kidney disease as depicted here. So this epidemic was first identified in Central America and in some parts of Mexico. There's hotspots have been identified in India and really across the equatorial regions, including there's been some case studies documented in the United States, Florida, Texas, and California. So how does this get us to AKI, acute kidney injury relative to chronic kidney disease? There's really two ways in which this has been proposed to occur. The first is that when people get very hot, we can have a clinically diagnosed acute kidney injury bout. So turns out that people diagnosed with heat stroke, one of the most common kind of comorbidities or co-occurring problems is acute kidney injury. These people have very high increases in serum creatinine, indicating that their kidneys are not filtering appropriately. And it's very well established that a single bout of clinically diagnosed AKI, sufficient to put someone in the hospital, increases the risk of developing chronic kidney disease. So here, the terminology CKD-NT, the NT stands for non-traditional, indicating that this is not associated with things like those traditional risk factors I mentioned before. There's also a secondary hypothesis or a related hypothesis that repeated bouts of hyperthermia that are not sufficient to bring about clinically diagnosed AKI, but bring about some subclinical AKI, so asymptomatic rises in serum creatinine and as well as increases in acute kidney injury biomarkers that when repeated can lead to CKD-NT. So this is not, a cyclist that goes out and rides in Phoenix or someone that goes for a hike on a hot day, in the desert once in a while. These are people that are doing this every day for months on end for years, right? And I think a lot of these equatorial regions, you're not having a reprieve during the winter, but it's not seasonal. It's hot pretty much year round. And it's repeated subclinical AKI bouts that can have been proposed to lead to this CKD-NT. Based on this hypothesis, a lot of our work has tried to understand what is the role of hyperthermia in bringing about this kind of subclinical AKI. And so we've done a number of different studies on this. We're going to highlight some of our lab work as well as some of our field work in this case. For our lab work, we've done a lot of work where we simulate work in an environmental chamber, and we can manipulate all different parameters, how hot it is, how humid it is, et cetera, make people work harder, make people work less. This example is someone's walking on a treadmill. We have upper body ergometers and rowers and things we can do to try to simulate what a worker is doing. And kind of looking across a big synopsis of a number of these studies, a postdoc in the lab, Hayden Hess, published a paper not too long ago where we really tried to understand what's the role of how hot people are getting relative to this marker of acute kidney injury risk. So you're going to see this quite often. This is the product of IGF-BP7 and TIM2. These are urinary biomarkers of acute kidney injury. You multiply them together, it has an FDA approval for clinically understanding the risk of developing acute kidney injury. And I should note, we're going to talk a little bit about the role of hydration in all of this in a second, but in all of these studies, the participants were well hydrated. So the percent change in body mass loss was less than 1%. So they're very well hydrated. But hopefully you can appreciate here that there's at least a moderate correlation between how hot these subjects are getting and this marker of acute kidney injury risk, such that the people that are the hottest had the greater increase in acute kidney injury risk. We've also taken this to the field. One of our early studies in construction is just an example of what some of these construction sites look like. Really hard manual labor up on the top left. Think you're pushing. They look like big squeegees. You're pushing, concrete around. It's very, very hard work. Even though in this case it's covered, so you're not in the direct sun. But then you also have roofers The person down below there with a roofer, he's actually using a blowtorch in order to kind of melt some of the tar paper. And so this is not just you're out in the sun, but you're actually using a lot of really hot materials as well. So we did something very similar where we looked at this AKI biomarker across a work shift in these construction workers. And so small sample, 34 people, but hopefully what you can appreciate here is a very similar relationship. So the workers that got the hottest typically had the greatest increase in this AKI risk marker. Should also note, this is not a controlled study. It was very much a pilot study. Hydration status did vary. We actually have new body mass before and after work, and as well as USG in this case. And hydration was not considered to be or not found to be a significant predictor of AKI risk in this case. Only how hot the workers got did dictate that. So of course, these are mostly correlational. These are observational type of studies. So we also set out to try to understand in a little more causal way, what is the role of core temperature or body temperature relative to things like hydration status as it relates to these AKI risk markers. And so we did a study here where we had 2 hours of just treadmill walking in this case at an intensity that looked somewhat similar to what we see in a lot of manual labor occupations in pretty warm, pretty hot, and somewhat humid conditions. So 39 degrees Celsius and 40% relative humidity. So in order to determine causality, we had to try to kind of tease apart, manipulate core temperature and hydration status. And so this is an example of what we did. We have 4 conditions. The first is a control. So people walked on the treadmill. They didn't get water. They did not get cooling. So you can see here they got hot. Average peak core temperature was almost 39 degrees Celsius. They lost about 2.5% of their body weight. We had a control condition, or sorry, we had a water condition where every 15 minutes they would get off the treadmill, they'd weigh themselves, we give them an equivalent amount of water to drink during that time. So the idea is let's try to completely replace all sweat loss by drinking. Then we had a cooling condition. So you can see in the blue, that's a blue compression top, and underneath that is a tube-lined suit. And we perfuse 5 degrees C water through that suit in order to prevent or try to attenuate the rise in core body temperature during this time. And so as you can see here, the rise in core temperature was attenuated. So these are the triangles is the cooling condition, but they still got somewhat dehydrated. So they're still sweating in this case, and they're not receiving any fluids. And then we had a water plus cooling condition. So they were cooled and they were allowed to, and they were given the fluids to offset the fluid losses. So what this allows us to do is to really untangle core temperature relative to how hydrated the workers were getting. So this is what we found. So again, this is on the y-axis, we have our marker of acute kidney injury risk. This is our urinary markers. And we're just presenting the peak. So what's the highest increase in these markers? This is usually collected in urine about an hour after the end of the treadmill test. So the control we see has the highest level. So these people were the hottest and the most dehydrated. Just by cooling them, we see a reduction in AKI risk. And when we have cooling and drinking, we have a reduction in this risk of AKI. But just by drinking, interestingly, there's no statistical difference. Now, you could argue that maybe that's just a statistical thing, but we were very interested in, is drinking alone sufficient to offset this increase in AKI risk? So based on this, we weren't quite sure yet. So we set out to do a study to try to understand this. And so here, this paper was just recently published. It was part of Erica Trula's PhD. And we had 2 conditions. So this is, again, similar model, 2 hours of exercise in the heat. We were doing manual labor. So again, upper body work here, a lot of treadmill walking. We did some work with a rower. And in one condition, we allowed people to drink ad libitum, which is consistent with the occupational heat stress guidelines. And then in the other, we completely restricted fluids. So we have about a 1% reduction in body weight in the drinking condition. So you need a little bit of dehydration to develop before people actually start to drink. And then in the no drinking, we lost about 3% of our body weight, but the peak core temperature responses did not differ in these two instances. So our main question was, what's going to happen with AKI risk? We thought that AKI risk would be higher in the no drinking condition due to the greater dehydration. And it turns out those lines could not lie more on top of each other. So there's no effect of drinking on this AKI risk. And so we found this quite perplexing. I'll not be looking for any feedback actually from this group. That'd be great. So this has led us to have a new hypothesis around the role of hydration as it relates to heat-induced AKI risk. It's very clear that being dehydrated in the absence of heat stress has been demonstrated to increase these biomarkers of AKI. So this is an example of a study done by Chris Chapman after he left our lab and then was a postdoc at the University of Oregon, where they did a 24-hour fluid restriction, and they compared that to 24 hours where they gave people a lot of fluids. And they showed pretty profound increases in the same biomarker of acute kidney injury risk when these people were dehydrated. So this is why we were pretty surprised that hydration didn't have a major impact on these markers in the heat. So this is my crude schematic of what we think might be happening. And it's entirely possible that once you get so hot, the effect of hydration status becomes negligible. Early on, it may matter, but there's some threshold that we don't quite know yet, beyond which the effect of heat is greater than the effect of hydration. So this is our working hypothesis for now. We haven't figured out a way to, I think to figure this out, we really need to drive up core temperature a lot more and maybe manipulate hydration status a little bit more. But I think it's reasonable to think about at this point. So most of our focus so far has been on, how hot people are getting and how this translates to these biomarkers of acute kidney injury. And, we're trying to figure out the role of hydration status. I think it's really important to think about, maybe there's ways in which we can better hydrate people. In most of our studies, we're using things like basic sport drinks, commercially available. So think Gatorade, whether they could be Gatorade Zero if we want to look at things to remove the effect of sugar, et cetera. So we're just trying to figure out this role of hydration. Okay, so the last bit of this, I just want to talk a little bit about how we can minimize the risks of heat in the workplace. So just so we're all on the same page, the goal of any intervention here in the workplace is to reduce the incidence of dangerously high core temperatures. Hopefully, we all took away the fact that dangerously high core temperatures or high core temperatures are the things that are dangerous. There's a lot of entities that have rules around this. So World Health Organization, NIOSH, ILO, like you can go down the list. And they've kind of established that, for an unacclimated worker, you don't want core temperature to really exceed 38 degrees Celsius. For an acclimated worker, you don't want core temperature to exceed 38.5, which are founded in a lot of the occupational epidemiology. I think it's really important to note that everyone knows what should work in the occupational space. So rest, shade, hydration, providing access to bathrooms, right? These are relatively simple, but they can be really challenging to implement successfully. There's a few reasons for this. Probably the biggest one is if you go tell an employer, hey, you need to give your workers time to rest in the shade, right? They're thinking like dollars going out the door, right? And so this is kind of where more recently we've thought a little bit about the economics of this, and we'll end the talk with some of those economics. But I wanted you to kind of put that in the back of your mind, that this is one of the big impediments to having relatively simple solutions successfully implemented. So we've done a number of studies in the lab. This is another example where we tried to understand the effects of these pretty simple like work to rest ratios on the management of hyperthermia risk. So In a big series of studies, we examined the NIOSH guidelines, which are very similar to those of you that are in the space of the ACGIH guidelines, where they prescribe work to rest ratios, so how much work people are doing per hour, as a function of rate of metabolic heat production, so how hard workers are working, as well as the workload temperature. And these circles represent the conditions that we examined. You can see most of them lie on the lines, which means that they're compliant with these NIOSH recommendations. And then there's two, H and G, or G and H, that are well off the lines, and these are non-compliant. Think of these as positive control scenarios. So in a paper published by Hayden Hess last year, he was very interested in looking across all of these conditions and seeing if these NIOSH recommendations were effective. And hopefully what you can appreciate from this figure is that they largely are. So this is mean core temperature. So core temperature throughout a 4-hour period of work in the heat where we're applying these recommendations. And you can see mean core temperature in virtually all scenarios. 65 out of 70 observations, core temperature was below 38 degrees Celsius. These are unacclimated workers, so that was the goal. So they do appear to work. If you look at compliant versus non-compliant, again, the majority of the observations in the compliant scenarios were below 38 degrees Celsius. But once you get non-compliant, we start to have a significant portion of those core temperatures above 38 degrees C. So these things do work. They're relatively simple. They were developed a long time ago. And so we thought it was important to go back and revisit. Similarly, if you look at the hydration recommendations say, hey, you should provide about 1 cup of fluid, or particularly if work's over 2 hours, 1 cup of a sport drink containing electrolytes, every 15 to 20 minutes. So in all of these studies, we allow the participants to drink, up to 237 milliliters of a sport drink, whether it's Gatorade or Gatorade Zero, depending on the study, every 20 minutes. And they can drink as much or as little as they want. It's interesting, if you force them to drink it, it's in a lot of instances, it's too much fluid. So when we look at ad libitum drinking in this case, this is a subset of the participants that we showed previously. You can see that the vast majority of the participants were not dehydrated at the end of that 4-hour period. So only one person had a change in body weight of greater than 2%. All of those are statistically different from a threshold of quote unquote dehydration at 2% body weight loss. So again, the hydration recommendations appear to be working just fine in this case. So next, I'd like to transition to what this looks like in the field. And these are some data from our partners at La Isla Network. They've done a lot of work in Central America in these sugarcane cutters that have very high risk of chronic kidney disease of non-traditional causes. And what they've done is they've implemented these heat safety paradigms within this really unique group of workers. So this is just an example of what a core temperature profile in a group of workers might look like without a heat safety intervention. And so, they have one rest break. They just allow the workers to work. You can see they're working from about 7 a.m. to almost 5 p.m. And, on average, they have an increased core temperature above 38 degrees Celsius for about 2.2 hours throughout that workday. Now, if you contrast that with workers at a job site in which there is a heat safety intervention, and you can see here we have numerous breaks. The workday is a lot shorter. The workday is shifted earlier. You can see that in this case, there's about 38 minutes of the workday on average. Workers have a core temperature of over 38 degrees. So we talked a little about the economic piece of this, but workers are working shorter. They're taking more breaks. So if you're an employer, the first thing you're thinking is, how can I afford this, right? So the next thing I want you to take away is that if you take care of your workers, good things happen. And I'm hopefully going to convince you of that as we move forward. So using work that La Isla Network, or data that La Isla Network collected, we, at the sugar mill in Nicaragua, we recently published a paper to try to understand the economic benefits. And so you're going to see data from 2017 to 2022. And it's going to look something like this. So in 2017, this is a baseline period, just what's going on with the current heat safety practices. Then they had a phase 1 where they tried a heat safety intervention. It wasn't perfect. And then by phase 2, they were perfecting, right? So think, how do we best implement this, et cetera? And so, we're going to look at the data across these years. So the first thing that's really important here is that the workers are taking more breaks and they have a shorter workday. But importantly, the productivity loss. So the amount of the productivity loss went from almost 15% down to below 5% with the intervention. So workers are more productive. And the important thing is you can put a dollar amount to that. This is the really kind of great thing about sugar is that productivity is a function of how much sugar cane the workers are cutting. And there's a dollar amount associated with the value of sugar on the open market, right? So you can figure out exactly how much of a savings this improvement in productivity is. And so you can see that productivity losses down about 5%, is resulting in almost $500,000 in cost savings that the mill is achieving with this intervention. We can also look at things like health. So talking about acute kidney injury, you can see that during the baseline period, about 120 cases in 2017. These are clinical acute kidney injury. This is they showed up at the mill clinic or hospital, and it was clinically diagnosed. Just the intervention with phase 1, you can see a massive, very big reduction in acute kidney injury cases, and that further decreased with phase 2. There's a dollar amount associated with treating acute kidney injury, such that you're saving almost $10,000 there in 2020 by lessening the number of cases of AKI. So how does this all go together? So we can look at this as a return on investment. So what we have in the gray squares is the value of the investment. So one thing we haven't talked about is that it does take money in order to properly implement a heat safety program. So think you're going to train the supervisors, you're going to have staff out there making sure that people are following it. You need money associated with buying these tents, making sure there's enough fluids. They're taking electrolyte solutions out there. How do we move these things along in the fields with the workers, et cetera? So you can see that in 2018, it costs about $300,000. It does go up a little bit over time with inflation, et cetera. But hopefully what you can appreciate here is that the value of the benefits, so the improved productivity and how much there was a cost savings from that, as well as the reduction in the cases of AKI and the cost savings associated with that. You can see that by 2020, those things were largely the same. And by 2021, 2022, the value of the benefits exceeded that of the investments. And so if you look at this as a return on investment, you can see early on, it costs a lot of money to have this intervention. You weren't really getting the benefits. But as soon as 2020 hits, you break even. By 2021, you're on the positive, such that only 4 years after the initial investment, the sugar mill saw a return of $1.60 for every $1 invested in the health of their workers from a heat safety perspective. So I think this is really important when we talk to different companies, et cetera. If you take care of your workers from the perspective of a lot of things, but even just heat, it has a pretty profound impact on the bottom line, despite that it does cost a little bit of money to get going. Okay, so everyone's still with me here. We'll just summarize, then we're happy to answer any questions. So hopefully today you've taken away that occupational heat stress is common, not dependent on heat waves, that occupational heat stress increases the risk of work-related injuries and heat illness, including heat stroke, and also heat injury. We talked a lot about acute kidney injury today, and it reduces worker productivity. I think the data are pretty strong that indicates that it's the hyperthermia exposure that underlies many of the safety, health, and productivity risks of occupational heat exposure, with hydration status likely playing a modifying factor. And we're not quite sure entirely yet what that role of hydration is in acute kidney injury, but I think we'll get it figured out. And then finally, successfully implemented heat safety interventions can reduce the incidence of both hyperthermia and dehydration, improve health outcomes, and then also demonstrate positive economic returns. So with that, again, I'd just like to say thank you, acknowledge all the collaborators, particularly those at IU, La Isla Network, Fabiano Morim at the University of New Mexico, people at the University of Buffalo, where I was previously, and then all the PhD students, postdocs, et cetera, that we've had work on this. So thank you.
So we have several questions in the Q&A. Let's start, and we'll go between the online questions and some from the audience from here.
Perfect.
You want to start, Holly, with the first one?
Thank you for your excellent presentation. My question is, what is the best marker to predict heat illness in workers?
Best marker?
To predict heat illness in workers.
Yeah, probably if we could get, Stavros and I were talking about this yesterday at dinner. If we could accurately estimate core temperature in workers, I think that's probably the best thing you can do. There's some tools to estimate core temperature in groups of workers that I think are very promising. And things like using wearables and stuff of that nature. We're doing a lot of that type of work now. So I think if we get an understanding of that, I think that would be probably the best thing to understand. But there's no one biomarker that I know of.
Do we have any questions from the room? Mason?
Appreciate you coming down here, by the way. And if I was a business owner, you would have convinced me.
All right.
So I compare your work to what is done in summer athletes or summer sports example. And correct me if I'm wrong here, I think they kind of have it figured out and they're able to just pretty much successfully implement standards and guidelines to keep an athlete safer because ultimately it gets better productivity and performance in the field.
Right.
Now, do you think speaking with companies, those companies tend to see short-term and long-term, would it be better off to work with maybe workers' unions and talk about modeling perhaps some aspect of summer sport guidelines and between high school, college, and NFL or professional to get your modifiers, I guess, implemented and to reduce risk for heat risk or heat illness?
Yeah, you're spot on. I think it's got to be multifactorial. And I should say, there are some companies doing amazing work at protecting their workers. And I'm not just saying this about Turner Construction because we work with them. Like, we go to their job sites and they have cooling stations. They have tons of resources. Now, that doesn't mean all the workers are using those resources. And so I think that's the implementation piece. So, but there are a lot of places doing a really good job. So, I think we have to hit it from multiple angles. Workers' unions has been part of it. We've been in touch with a lot of them. Admittedly, some of that stuff, a lot of this is these collaborative efforts to people that are much better at the policy side and stuff like that. Working with individual companies. I know that there's a lot of people working with airlines and postal delivery or parcel delivery companies, construction, et cetera. So there's that aspect. And then the other side of this that we're sort of involved with is that policy piece, like OSHA and some of those type of things. And I think if we hit it on all three of those fronts, with enough information, enough people with different expertises coming together, I think that will ultimately push the field forward. So you're spot on. I think there's a lot we can learn from places that have done this really well. We do a lot of our work in the occupation space is based on the military. The Army does a really good job of this. But what's interesting is, a lot of those rules are around training, and you can reschedule training. In a lot of instances in these jobs, you're not rescheduling the job unless it's super, super extreme. So thinking about what these compromises are and how people can do that, I think is really important. But absolutely, multifaceted approaches. Yeah, that answer your question?
Yeah.
Please recall the incidence of heat stroke and heat exhaustion among the construction workers and field laborers that you have observed.
Yeah, in the workers we've observed, we've never seen heat stroke, heat exhaustion, et cetera. Now, keep in mind, we're on job sites with these commercial construction sites have 3 to 5 up to 7,000 workers entering that job site a day. The most we've ever instrumented is 204 of them, which is a huge number of people for physiology studies. But it's a small fraction of those on that job site themselves. So we're working with companies to try to get an understanding of what exactly those incidences are, but we don't have those numbers.
Is there another question from here? We have tons of questions and.
Yes, I have a question. Thanks, Zach. You mentioned at one of the studies that they were well hydrated, that they were within 1% body weight change. But earlier on a slide, you said that the 0.0008 increase in USG could increase their risk of heat illness or heat stroke or having a temperature above 38.0.
Yeah.
Okay. So the fact that you saw that they were within a small range of body weight change, how was their general hydration, how they came in? Because that could potentially influence as well then the situation, right?
Absolutely. Yeah. So that's something we're really interested in, because what's fascinating or maybe not surprising, but at the time it was surprising. With our first field study, was like 40 workers just trying to figure this out. And what was surprising is about 60% of the workers walked in with a USG of over like 1.025, right? So like they were walking in the door dehydrated. Though they did not become more or less dehydrated during the workday. So it's the same amount of them left dehydrated, but they drank during the workday. So that tells us that their practices on the job in the heat are pretty good, but it's what's happening outside of work, right? So we're like, okay, maybe that's just a small fraction of this big job site. So the data we presented with the USG and the risk of hyperthermia, that's in about 200 workers or so. And we saw the exact same thing. I mean, if you show up dehydrated, you end the day dehydrated, you're not changing where you are. And so again, that really highlighted this role of overnights. And it's a big challenge for, the occupational health and safety people, because they're responsible for what people do on the job site, and, intervening in the off hours is really challenging. We're very interested in how that may translate to health outcomes. And we're trying to figure that out. We haven't quite figured it out yet. But that reflects, depending on how you look at hydration, if you're using urinary markers versus, changes in body weight acutely, those are two different things. And so we haven't quite figured that out, but we haven't identified anything that says if you come in dehydrated, that makes everything worse yet. And we're still trying to work through some of this data. But it's a really good point, and I think it really highlights what's happening in the off hours is vital. So it's an education campaign. We're working with Turner. Thanks. Yeah.
Okay.
We had another question that was nearly identical.
Right. Perfect.
Were you able to measure WBGT on site in your studies? If so, what kind of equipment did you use?
Yeah. So we measure. Okay, so these are big job sites. So we have at least 8 devices. We, for the most part, are using Kestrel devices, Kestrel 5400. It's not perfect. The globe's small. There's a number of different, it's not actually measuring wet bulb temperature, stuff of that nature. But what it does allow us to do is to put it around numerous different locations. One of the important things and one of the takeaways, we're still working on some of the papers related to this, is that a single location does not reflect the WBGT that the workers are experiencing. So imagine you have spots on the roof relative to open air. These are not air conditioned, but they're covered, right? And sometimes there's a breeze and sometimes there's not. And sometimes it's like an enclosed space that's very humid and stuff of that nature. So we're trying to work through how best to document these things. But we put through 8 up and we figure out about where the workers are in the building, and we use that as their personal weather.
Thank you for your great talk. Most of your field measurements were done in humid and warm conditions. Phoenix is very hot, dry, and sunny. Would you expect the same interventions to work as well in Phoenix?
I don't see why they wouldn't. Yeah, there may be a few differences, like, um, fans, may not work as well in certain instances because it's just so hot and increases dry heat exchange, dry heat gain. Yeah. So, a lot of these spots have big spots for fans and cooling stations have a lot of fans. So there may be a few nuances, but breaks and shade should work anywhere, and drinking should work anywhere. So I think it should work.
From a physiological perspective, is there a point at which heat strain becomes noticeable to the person, for example, through fatigue, dizziness, discomfort, or reduced capacity?
Yeah, 100%. Yeah. Now what's interesting is, you know, in a lot of these instances, these people are making a living by being tough and like toughing out these conditions. So if you're not used to it and you have the ability to be like, I'm just going to do a different job and I'll make the same amount of money, then people would do that, right? But in this case, they've trained themselves to like push through it in a lot of ways. And, there's a lot of other external pressures we have to keep in mind. So think on a construction site, they have a timeline and they have certain things that they have pressure from their supervisor and the supervisor above. And so, there's a lot that goes into it, but certainly there are a lot of symptoms associated with excessive heat strain.
For studies that cannot measure core temperature or physiological strain directly, would you recommend using self-reported symptoms, activity patterns, work intensity, or access to cooling proxies as bodily heat strain?
Yeah, I think in the absence of any of that information, probably you could get some information on that. Now, anything self-reported can be a little challenging to properly understand what's going on. But you'd rather have that information than no information. But absolutely, I think a big challenge is the big challenge with like, hey, body temperature and how hot workers are getting is the exposure we need to care about. Now it's how do we measure that exposure when it's relatively easy to measure WBGT or it's relatively easy to measure heat index and everyone has a weather app. And so I think that's where kind of the next steps in innovation need to occur. And we're getting there. Wearables and AI, and I think all of our dinner conversations keep coming up, Stavros. But I think with the right people, I think we can get there.
Can I ask you, not a question per se, but to make a comment? I was looking at your diagrams of the cost analysis that you do. That is super nice. That it shows, it does pay back. Just a quick comment that we keep talking about the risk of. There are people dying in this situation. So what would be like a lawsuit, for example? I was looking in the y-axis in hundreds of thousands. You get a lawsuit. This is like millions and millions of dollars. So
Yeah.
is it something that you can look into your calculations, like based on mortality data, and add it in your calculation to show the true benefit?
Yep. 100%. So this is all already laid out in the OSHA standard. They've done these analyses and they clearly demonstrate that this is a huge financial burden on all industries. And, you're talking about someone dying on a job site with insufficient protections being millions of dollars lawsuit. And we actually work with some of the insurers and stuff like that are associated with Turner Construction on a lot of this for that exact reason. Is again, taking care of the workers, it means a lot for the worker, it means a lot for the companies, it means a lot for the insurers. And so, that's kind of where we're thinking. But they have done a lot of these analyses across multiple industries. Now, what's interesting about the sugarcane example is this mill and a lot of the mills in Central America had a vested interest in protecting the kidneys of their workforce. Because what was happening is they were losing tons of workers and they did not have the pipeline to fill them. And there's other people that know a lot more information on this than I do. But so the mill knew it was in their best interest to do whatever they could to protect the kidneys of their workers. And And this intervention was one of the things that really helped them in that way. So you're 100% right. This is not a risk. Like, this is not a theoretical risk. This is a real risk in a lot of these instances.
Thank you. Let's take one more question. We have about 6 or 7 more. We'll take one more and we call it.
Sounds good.
Really interesting studies, doing a great translational job. Do you think the studies done in laboratory settings to unveil mechanisms behind kidney injury could bring different results if they were done in actual workers from those sites from Central America?
So if I understand the question correctly, if we took a worker from Central America and brought him into the lab, would it look any different? Is if that's the case, I don't know. You know, my initial thought is human physiology is human physiology. But if you have some sort of underlying reduction in renal reserve, think of that as your ability of the kidneys to kind of buffer against these stressors. If that's already there, then it could look very different. And so just trying to understand those differences, we don't entirely know. But I think what's really important is we can do things in a lab that we can't do in the field. We can do things in the field that we can't do in the lab. And being able to bridge those two, I think what's really surprising is that we do see a lot of the same parallels. Like the moderate correlation between how hot workers are getting in the AKI risk in the construction workers, that R value is the exact same whether you're in the lab or in the field. And so I think that it's important to try to start to bridge these things because you're spot on. Workers, our lab work is for the most part relatively healthy, younger people. In the field, you know, we have all ages, different. Everyone, a lot of people have hypertension, a lot of people have type 2 diabetes, et cetera. So I think that we just need to keep doing this work across both lab and field.
All right. Thank you.
Thank you.